Assalamu alaikum viewers, this is Dr. Khawaja Saajid with program Bone and Health. I'm orthopedic hip and knee replacement surgeon. Today we're going to discuss about the total knee replacement. We did one program earlier about same topic, but that was in Urdu, so I thought why not to do one program in English so our viewers who can understand only English, so this message could reach up to them as well. Today we'll discuss only about how we do this operation. What are the benefits of this operation? What are the disadvantages? I know there's a lot of myths about this operation. Many people are scared to go ahead for this kind of surgical intervention. I think is more curiosity or more fear about this procedure is in Asian country or in those countries where this kind of procedure is just introducing. So people have a lot of questions, a lot of worries, queries, how they do, will they take something from my joint and put something new over there, or will I be able to walk afterwards, or I will just be on the wheelchair for the rest of my life. So a lot of worries about that. Let me explain to you a bit about the operation, how we do operation. So probably it will answer a lot of your queries. We do this operation under spinal anesthesia. We give injection in your back, spine, and below the umbilicus you don't feel anything. You are completely pain-free. You are awake. We don't give you general anesthesia or tube in your mouth. So you stay awake and we do this operation. This operation takes around 1 to 1.5 hours. So it's not a unusually longer duration operation than any other operation. So it's just like any other operation you underwent. So 1.5 hour operation. The day you get your operation, on same day after 6 hours, you walk. I let my patients walk full weight bearing on that leg after 6 hours of operation. And generally speaking, after a couple of days, patient can go home by walking. So there are no restrictions about this operation that you shall not put weight on this leg or take rest for 3 weeks or 6 weeks. Sometimes I would say most of people in my country, they feel that once you get the operation, especially hip or knee or lower limb operation, legs operation, you stay on the bed for about 3 weeks or 6 weeks or 3 months. For the knee replacement, it's not like that. You walk on the same day. So this is a different operation than other. We don't take anything from your joint. So many people, they when they come in my clinic, they say, will you take something from my joint or put a new joint over there? So it's not like that. We don't take anything from your joint. When the bones, they rub each other, they're already teared off, bones are rubbed off. So we just freshen their edges and put a metal in the leg bone and put a metal on the thigh bone. And in between the meniscus, the cartilage, which is weared off, we insert the plastic on that. So you can see on the screen one of the X-ray, which is prior to operation. You can see when both bones are meeting each other and rubbing each other. When you walk, that's how you get the pain. And second X-ray radiograph, you can see post-op, and you can see there's a beautiful space between two bones. And this is not a space actually. We insert the plastic in between to replace the cartilage and meniscus. What are the benefits for this operation? Why shall you go ahead for such kind of operation? The single most benefit for this operation is the day you get this operation, your arthritic pain is completely gone. It's not reduced, it's completely gone, it's zero. The pain you feel is the operative pain. Just like any other operation, you feel pain after a couple of weeks. When the sutures are removed, your pain gradually wean off. So arthritic pain is completely relieved, completely gone on day 1. That is the single most benefit. So you get pain-free joint. So benefit of pain-free joint is you can walk longer distance, 5-6 kilometers you can walk, pain-free and without painkillers, without medication. Then you become the active part of the society, active member of the society. You can enjoy the rest of your life You can do your job, you can enjoy, you can do your hobbies. That's a life. What are the problems related to such kind of operation? First of all is infection. Infection of the wound. There's a 1% chance of infection of the wound. Infection can be just like any other operation you go ahead. So there are chances to have infection. So 1%. Second thing is blood can clot in your leg vein, which is called DVT, deep venous thrombosis. It can lead to pulmonary embolism as well, that clot can reach to your lungs and can be fatal as well. So to minimize that risk, we give the blood thinning medication for 15 days. Otherwise, there are no potential problems or complications for such kind of operation. And ideally speaking, there are no precautions that you have to move certain directions for this joint. Yes, for the hip replacement, there are certain precautions. For the knee, there are not actually any precaution for that. You just have to walk. So it's a wonderful operation. You shall go ahead for that. If your orthopedic surgeon advised you to go ahead for that, you shall go ahead for that. If you have queries, you have questions, you have some worries, I would advise you to discuss only with that doctor, only with that orthopedic surgeon who knows how to do knee replacement. There are plenty of orthopedic surgeons who does not know, who doesn't do such kind of operations, because once you become orthopedic surgeon, you choose a specialty. Then inside that specialty, you choose a subspecialty to become the hip and knee surgeon, replacement surgeon, or you do the spine or other. So you shall discuss these kind of worries only with that orthopedic surgeon who knows how to do and who is performing such kind of operation. So he is the one who can answer you very well, who can discuss this problem with you. So go ahead for this operation. It's very simple and it's a life-changing procedure. It's a life-changing procedure, believe me. On display is my number there. If you want to discuss further about this topic, you can get the appointment and we can discuss in detail. Thank you.